is a human right, but for many immigrants, it remains out of reach. Breaking Barriers, Healthcare Access for Immigrants, a documentary on challenges and solutions. In our communities, thousands of immigrants struggle daily to access even the most basic healthcare. Language barriers, fear of deportation, and lack of insurance prevent many from getting the help they need. Understanding healthcare access for immigrants. Immigrants face numerous barriers to accessing healthcare, including language obstacles, cultural misunderstandings, and lack of information on available services. Additionally, fear of discrimination and legal repercussions often prevent them from seeking necessary medical help. Access to healthcare is vital for immigrants' overall well being, enabling them to receive preventative care, manage chronic conditions, and reduce emergency room visits. Improving access can enhance public health significantly with diverse communities. In the US, nearly 25% of immigrants lack health care insurance compared to 9% of native born citizens. Furthermore, studies indicate that immigrants are less likely to receive timely medical care and preventative services, heightening health disparities. Research findings. Key challenges identified. Many immigrants encounter language barriers, lack of health insurance, and cultural differences, which prevent them from seeking necessary care. Additionally, systemic issues such as immigration status and fear of deportation discourage engagement with healthcare services. Initial analysis indicates a strong correlation between limited healthcare access and negative healthcare outcomes among immigrants. Research highlights disparities in chronic disease management and preventative care, indicating a need for targeted interventions. Limited healthcare access leads to increased emergency room visits and overall poor health conditions among immigrant populations. Furthermore, the inability to access preventative services heightens health issues, resulting in higher long term costs for individuals and the healthcare systems. Community engagement in healthcare access. Interview with Brianna Reyes Soto, a MedServe fellow at Hope Community Clinic. Brianna originally wanted to pursue social work to advocate for immigrant families like hers, but watching her single mom struggle with asthma and seeing how her community faced barriers when seeking medical help inspired her to no longer pursue social work, but to become a doctor. Brianna got her degree in biology and is currently waiting to get into med school. This is Brianna's answers to some of the questions that I asked during our interview, and I'm going to be quoting some of the things that stood out to me. Okay, so at I'm gonna be quoting Brianna. At Hope Community Clinic, we serve underserved and low income patients, many of whom are immigrants. As a medical assistant, I support our providers and also serve as a translator for our Spanish speaking patients. A large part of my role involves breaking down communication barriers and helping patients feel comfortable navigating the healthcare system. For Brianna, being a Hispanic and the daughter of immigrants, I've always felt deeply connected to the immigrant community. I saw firsthand the struggle my own family and neighbors faced when trying to access basic health care. With limited transportation, language barriers, lack of insurance, and fear of deportation, that inspired me to pursue a role where I could actively help others overcome those challenges. Brianna's story reflects the reality of many immigrants in Charlotte, navigating a complex and costly system often alone. When Brianna was asked what inspired you to focus your work on helping immigrants population access healthcare, she responded that my inspiration comes from wanting to bridge the gap for immigrants who lack legal status and face constant barriers to care. Working as a medical assistant, she has seen how costly and confusing healthcare can be for those unfamiliar with the systems. Hope Community Clinic gives me a space to support and advocate for patients who often fall through the cracks due to their immigration status. Okay. When she was asked, "Can you share a specific example of when healthcare services made a meaningful difference in an immigrant's life?" She responded, "Our clinic partners with Caring, which connects uninsured patients to specialists for only $50. I remember a patient who had gone years without care due to cost. Through Caring, she was able to see a cardiologist and begin treatment. Programs like these are essential since they remove financial and logistic barriers and give immigrants a fighting chance for better health." When Brown was also asked, "In your opinion, what are the biggest healthcare challenges immigrants face in immigrant communities in Charlotte are still facing?" She responds that the cost of care remains a huge issue, especially for those without insurance or immigration documentation. Dental care is one of the most inaccessible, expensive, and hard to find services that offer low cost dental work. I've also seen patients stuck on long wait lists. Language barriers and transportation also continue to delay or prevent care altogether. Moving on to feedback and suggestions. One of the things that stood out was when I asked, "What improvements or changes would you recommend to make healthcare services more accessible and welcoming for immigrants?" Brianna responded with, "We need multilingual resources, not just in Spanish, but in other languages spoken by our immigrant communities. Clear, culturally sensitive communication helps patients understand their rights and options. Training healthcare workers on cultural competency is also key." Some of the things more linked to the whole community clinic was when I asked her, "Are there any new services, programs, or outreach efforts you think would better meet the healthcare needs of immigrant population? Does your clinic offer something others don't?" And then she responded with, "Yes, Hope Community Clinic offers programs like Caring and MedAssist. Caring allows uninsured patients to see specialists affordably, and MedAssist delivers medications directly to patients' homes at no cost. These programs help address major barriers like cost and transportation, and they make a real difference for immigrants and immigrant families." I also had asked her, "How can healthcare providers and community organizations work better together to support immigrant healthcare needs?" She stated that collaboration starts with understanding providers and organizations need to recognize the unique challenges immigrants face legal status, language, trauma, and more. When we come together with that knowledge, we can build programs that truly meet people where they are. Okay. Future visions. The last bit of the interview really stood out to me. When I had asked her, "What are your hopes for the future regarding healthcare access for immigrants in Charlotte?" She stated "I hope to see expanded dental services for immigrants. Too many patients go untreated because dental care is so expensive and unavailable. We need more clinics willing to offer these services at low or no cost." How do you see your ongoing role in supporting better healthcare outcomes for immigrant communities? Brianna quoted, "As a medical assistant, I'm often the first or second face patients see. I want to continue being a familiar and comforting presence, someone who listens and advocates. My goal is to create a welcoming space where immigrants feel safe and understood." Lastly, I had asked her, "What advice would you give to new healthcare workers or social workers who want to advocate for immigrants' health needs?" She stated, "Educate yourself on barriers immigrants face, including language, legal status, cultural stigma, and lack of resources. Be open minded, compassionate, and culturally aware. Join organizations that support immigrants' rights and healthcare access. Above all, be an advocate. Even small efforts make a big difference." Like Brianna, many believe that fight for healthcare equity begins by listening to those most affected and transforming their stories into meaningful actions. In conclusion, I really enjoyed interviewing Brianna as a representative of Hope Community Clinic. This is the community engagement interview request form. Initially, I had given the documents in person for Brianna to sign, but she had to leave due to getting a call from work. And we struggled getting a physical signature since she tried emailing me a scanned form, but the document, the file ended up being corrupt. So lastly, our last resort was to get a DocuSign with her signature right there. Okay, moving on to my Flipboard articles. Okay, these are my Flipboard articles. As through my community engagement project, I focused on raising awareness, and through that, we had to do a little bit of research. For this project, I looked at some important articles to help us understand the healthcare challenges immigrants face. These articles gave us information and numbers we need to push for better access for healthcare. And we also included a video in there. One of the articles shared that nearly 1 in 3 immigrants don't have health insurance. This means many immigrants are dealing with serious health problems that could have been avoided if they had better access to care. Another article in here, I believe it's that one, also mentioned how language barriers and fear of deportation stop many immigrants from seeking care. By looking at these articles, I learned more about the struggles immigrants face and the programs that are already making a difference. This knowledge helps us keep pushing for change. I also added the interview and the infographic on the Flipboard for easier access. Okay. Okay. Through my community engagement project, I focused on raising awareness about these barriers by launching a Latino Care Access campaign, an initiative that uses social media and community partnerships to spotlight healthcare access faced by immigrants. The social media campaign also aimed to raise awareness about immigrant healthcare issues through informative posts and statistics. Okay. And then here is the Instagram account. So in the Instagram account, we've uploaded our infographic, and we also have highlights with additional information that also included in both languages. So English and Spanish. Then a couple of resources like Camino Salud, which is a clinic that helps Hispanics. This one is for dental, and this one's for just general medicine. And it gives you the phone number to make the appointment. And then this is just more information. One of the things we used as part of the campaign, we posted this message inviting our followers to share their personal healthcare stories. The idea was to give them a platform to speak out, connect with others, and feel heard. We asked them to tag us using the hashtag Latino Care Voices, allowing us to gather real stories that show the impact of healthcare barriers on immigrant communities. Okay, and besides posting it in English, we also posted it in Spanish. Okay. Additionally, we shared information about local clinics and resources that offer low cost or free healthcare services for uninsured immigrants. Posts included the names of clinics like the Hope Community Clinic, We wanted to make sure that people knew where to turn when they need help and that resources were accessible to them. Okay. So we shared the Hope Community Clinic, and of course, besides it being in English, we also provided it in Spanish. At the beginning, we made a little introduction, just introducing ourselves, how we're here to help Hispanic immigrants find affordable, accessible healthcare in Charlotte, North Carolina. No one should struggle to get the care they need, and we're dedicated to connecting you with resources, clinics, and support all in one place, being the social media account. We also put that in Spanish to make it easier for some followers who can't read in English. We also posted a little fact to crush a myth, and it was that undocumented immigrants are largely ineligible for federal health care programs like Medicaid and Medicare, and are ineligible for most federal health care benefits aside from emergency care. This is a stigma with Hispanics. Most people believe that Hispanics rely on federal help, but most of the time they don't even qualify due to their immigration status. They would only qualify for emergency care, and even that, the person or individual has to really be almost dying to really receive it. Okay. Next, we posted an informational post: healthcare access for immigrants, barriers to healthcare, lack of insurance options, language and cultural barriers, fear of immigration enforcement, limited knowledge of available resources, and of course, besides posting in English, we also posted it in Spanish: acceso a atención médica para inmigrantes. And then I continued saying the same thing from the previous post. This is a bilingual healthcare hotline, a free helpline for medical information and medical assistance. I provided just that resource that included the times they were available to take the calls, the phone number, and the website in case they need additional information. And of course, we put it in Spanish as well, so some of our followers can understand. And we already reviewed the Hope Clinic and this one. Okay. Okay. And our social media campaign and infographic was provided illustrating the health statistics for immigrants. Resource images like the Camino Health Clinic and the Hope Community Clinic, just how to contact them and just additional information. All visuals were both in English and Spanish to make it easier for the followers that don't understand English. There's also a post encouraging the community to share their voices, providing a platform for individuals to feel heard and seen. Okay. And then this is the updated infographic. Healthcare access for immigrants: 45% of undocumented immigrants in the US lack healthcare insurance. 1 in 4 immigrant families avoid medical care due to fear of deportation. Non-citizens are 3 times more likely to be uninsured than US citizens. Okay. And I also added the barriers that I posted separately in the social media post. And I also put it put the vital need for healthcare access, how healthcare is a fundamental human right, ensuring everyone receives quality care regarding of status. Without access, untreated illnesses can lead to costly emergency visits, placing financial strain on individuals and the healthcare system. I also added a resource clinic at the end that serves low income in the immigrant population. I provided the address and phone number to make it easier to access for anyone who needs that information. Okay. Advocacy and evaluation. Okay, so overview of the advocacy plan. Some things I was not managed to get completely, and then this is just overall advocacy plan. Firstly, we identified the issue, which was focused on the lack of accessibility, affordable healthcare for immigrants, especially those who are undocumented or have limited English proficiency. Second, by we I mean I, created a social media campaign, which the Instagram page was Latino Care Access, and it was to raise awareness, share resources, and amplify immigrant voices using hashtag Latino Care Voices, and Healthcare for All. Community collaboration partnered with local organizations and healthcare clinics to share information on low cost or free healthcare services and support networks. Using the Hope Community Clinic with Brianna, and the interview with Brianna, sharing that information on the Instagram, and the Camino Health Clinic as well. Storytelling for change. We weren't able to collect that many personal stories besides the one with Brianna, but and her family. But from that, and we, I want to get personal stories if I were to continue these further, from immigrants to who humanize the issue and advocate for compassionate healthcare policies. Education and outreach. We shared. Well, I keep saying we. I shared infographics with bilingual content, which were the English and then translated to Spanish, and policy updates to inform the public and reduce stigma surrounding immigrant healthcare access. Um, I didn't get to this one in my advocacy plan, but I would have liked to encourage followers to attend local meetings, volunteer with immigrant support agencies, and support policy changes that expand healthcare access. Overall, some of the evaluation of efforts and what I learned: increased awareness. My social media campaign and community engagement helped me raise awareness about the barriers immigrants face in accessing healthcare, such as language, fear of deportation, and cost. Valuable lesson learned. I learned the importance of using social media for advocacy, the value of community voices, and how local agencies can support immigrant healthcare needs. I really did enjoy the fact that we incorporated the social media into this, and it kind of made it real once we started getting likes, or at least me, like once I started getting likes and followers and just messages to ask for more information. I'm not sure if I shared this, but I had another nonprofit reach out to me if I had a website so she can learn more about your organization and how do you connect people. Obviously, this wasn't really real, like we weren't really um taking it that far, but it's another nonprofit organization, and if we get to like work together, it could definitely reach more people. Areas to improve. I wish I could have expanded the outreach to more diverse immigrant groups. I only focused it on Latinos and Hispanics, but I would have loved to reach like Ukrainian refugees and other immigrant populations that also probably have barriers now. And I would have also liked to strengthen follow up with those interested in resources or support. If I decide to move this forward, I would have liked to interact with patients and just people from the community who actually need help and follow up with them, just to try to help out and do the best I can. Okay. In conclusion, our community